All right, my name is Shelby Davidson. Hello, my name is Shelby. I'm going to be your nurse practitioner student today. We're going to be doing the head, ENT, and lymphatic exam. So we're first going to start with the Snellen test. I will have a sign that's about 20 feet away. I'll have you read the lowest line covering one eye. Whenever you're ready.
LTFPH.
Alrighty, and switch eyes.
LTFPH.
Alrighty, and both eyes.
LTFPH.
Nice job. Alrighty, you were able to complete the lowest line, which is 20/20. Nice job. I'm now going to check your peripheral vision. So I'm going to have you cover one eye, and I'm going to cover the opposite. I'm going to wiggle my fingers, and you tell me when you see them.
There. 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 There.
Alright, nice job. And switch to the other eye.
There. 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 There.
Alright, nice job. Your peripheral vision is intact. You were able to see my fingers for all four quadrants. Now I'm going to inspect your eyes. Looking at your eyelids, there's no drooping noted, no swelling, and no lesions. Looking at your lacrimal apparatus, there's no extra tearing, no drainage, and there's no swelling bilaterally, which is great. Now I'm going to touch around your eyes and have you look up for me. Alright, your conjunctiva is pink with your sclera's being white, no yellowing noted, which is good. Now I'm going to take a look in your eyes with a light. So I'll just have you look over my shoulder just to focus on an object, okay? Alright, nice job. Alright, your corneas are clear and your lenses are clear and smooth with no opacities. And looking at your pupils, they are equal, round, reactive to light, and accommodating, which is great. And your corneal light reflection was noted also bilaterally. Now I'm going to do extraocular movements. So I'm going to have you not move your head. You're going to follow my finger, okay? Alright, nice job. Your eyes move smoothly, no nystagmus noted, and you were able to complete all the movements with your eyes. So now I'm going to take a look. Actually, we're going to do a cover-uncover test. I'll have you focus again with the object behind me. I'll have you cover one eye, and then when I tell you to uncover, you can uncover. Nice job. Now cover the other eye and do it again. Nice job. I noted that your eyes were fixed for both eye coverings, which is great. So now we're going to move on to me looking at your eyes again, but I'm going to first turn off the light. Alright, now that the room is darkened, I'm going to look at your eyes closer with the light, okay? I'll just have you once again just kind of look over my shoulder. Alrighty, your red reflexes are present bilaterally. Your optical discs are pinkish yellow, and no swelling was noted. And your retinal vessels were visible with artery and veins being about 2 to 3 ratio, which is what we like. and your fundus had no hemorrhaging or swelling noted, which is great. I'm going to turn the light back on real quickly. Alright, so moving on, we're going to now look at the ears. Let me switch this out really quickly. Alright, so looking at ears, looking head on also. Alright, ears look symmetrical, no deformities, no masses noted, no drainage coming out of them. I'm just going to feel your ears now. Let me know if there's any pain or tenderness. Alright. Any pain or tenderness?
Nope.
Alright, perfect. So no pain or tenderness noted in the auricle, mastoid, or the T-word. Now I'm going to take a look in your ears. So I'll just have you stay how you are. I'm just going to pull up and out on your auricle. Okay. Alright, looking in your ear canal. I see no, there's a little bit of serum, no swelling, no drainage. Tympanic membrane is pearly gray, and I'm going to look in this here now. I'm going to pull out and away. Okay, again I see nice mucus, or what are we looking in? Your ear canals are moist and pink, a little bit of serum, but no polyps or lesions noted. Your tympanic membrane is also pearly gray, no swelling noted, and they're symmetrical. Now we're going to do some hearing tests. First we're going to do a whisper test. I'm going to stand behind you. I'm going to have you cover one ear, and you're going to tell me what word that I whisper to you. Okay?
Dragon.
Alright, nice job. Switch ears.
Cupcake.
Alrighty, nice job. Alright, you were able to complete the whisper test. You heard dragon and cupcake correctly. Now we're going to do the Weber test. I am going to stand behind you again, have you close your eyes, and wherever you feel, or wherever you hear the fork, you tell me.
Right. Left. Middle.
Alright, you were able to complete the Weber test. You heard with correct both ears and no lateralization. So now we're going to do the Rhine test, where I'm going to touch you with the tuning fork behind your ear, and once you stop hearing it, tell me, and then I will put it in front of your ear, and you tell me when you stop hearing it, okay?
Stop. Stop.
Alright, nice job. I'm ready to do it over here.
Stop. Stop.
Okay. Air conduction is heard longer than bone conduction, which is good, which is what we want. Now we're going to move on to your nose. Looking at your nose, there's a little bit of curvature, but your nose is symmetrical to your face. There's no deformities of any crazy sorts, and no masses noted. I'm going to touch your nose. Let me know if there's any pain or tenderness. Any pain?
Nope.
Perfect. Alrighty, so now I'm going to we're going to check your patency. So I'm going to have you close one nostril and breathe in for me. Same on the other side. Perfect. patency is good on both sides. Sounds like there's good airflow. Now I'm going to take a look inside your nose. I'm going to have you tilt your head up just a little bit, and I'm going to take a look. Okay. Alright, nasal mucosa bilaterally, maybe. Alright. Is pink and moist. There is no drainage, no polyps, no lesions, which looks good. Now we're going to look at your lips and your mouth and throat. So looking at your lips, they're pink and moist, no cracking, no dryness. So now I'm going to have you smile at me. Nice, okay. Looks like gums are no bleeding noted, they're nice and pink and firm. Teeth are aligned and white and intact. Have you open your mouth for me. Okay, looking at your oral mucosa, pink and moist with no opacities, no lesions. Say ah. And stick your tongue out. Perfect. Okay, you can close your mouth. So looking sees that your soft palate moves symmetrically. Your hard palate is pale and pink and firm, and your pharynx is no abnormalities noted and symmetrical. Tonsils were not swollen, I would say 0+, and your tongue is pink, moist, and happily is noted, which is all very good. Now I'm going to feel your lymph nodes. I'm just going to touch around your face and your neck. So starting, we have the submental, submandibular. I'll go behind you. You're taller than me. Tonsillar, preauricular, postauricular, occipital, and then don't know if I said tonsillar, so I'm going to do tonsillar again if so. And then we have the superficial cervical, and then we have the, I'll have you turn your head just a little bit, auricular, and then other side, anterior. Okay, and then we got the posterior. And then we have the supraclavicular and infraclavicular. Any pain or tenderness noted?
Nope.
Okay. And I did not feel any of them, which is good, and no pain or tenderness is what we'd like. And nice job. We are all done with our exam, okay?
Alright.